Hi, my name is Gregg. This is my presentation for the neurotransmitter serotonin. I'll be discussing where it's found in the brain, the pathway that serotonin takes, the receptors that it uses, um, cues of an excess and a deficiency. I'll discuss two types of psychiatric illnesses or illnesses in general that can be caused from it. And then I have my reference slide. Serotonin is found in the neurons that are located in the brainstem in the raphe nuclei. These project diffusely in all regions to our cortex, our temporal limbic regions, the hypothalamus, the basal ganglia, the cerebellum, and the brainstem, and the spinal cord. This image here was taken from a pathophysiology book. It shows the location of the raphe nucleus, and then the blue lines is how it extends in the pathways that it takes in the brain. Serotonin is an amino acid. It starts with the amino acid tryptophan, and in two steps, we have serotonin. Tryptophan is converted into hydroxytryptophan, which is abbreviated as 5-HTP. Then it's converted into hydroxytryptamine, which is 5-HT, and this is serotonin. The receptors that it uses is 5-HT1 through 7, and each of these receptors have subreceptors. So your 5-HT1 actually has 5-HT1A, B, D, I, E, 1F, and so on and so forth. An example of what these receptors do, your HT2 accounts for depression, suicide, antipsychotic effects, hypotension, and ejaculatory dysfunction. So each of these receptors are responsible for different actions. When we look for what type of cues or symptoms that a patient would have with an excess or a deficiency, if we don't have enough serotonin, it can affect our learning, our memory, our ability to concentrate, our mood. Serotonin plays several roles in our body. It can regulate our temperature, our sleep, our sexual behavior, and our hunger. So many people think that if they don't have enough of it, if they take more, they'll be extra happy. But on the contrary, an excess amount of serotonin can cause muscle rigidity, fever, and even seizures. Illnesses that can be caused by a lack of serotonin could be major depressive disorder, and too much serotonin can be serotonin syndrome. With depression, there's some main neurotransmitters that are involved in our mood, and that is serotonin and norepinephrine. Serotonin is important for regular sleep, appetite, libido. Therefore, serotonin circuit dysfunction can result in sleep disturbances, decreased appetite, low sex drive, poor impulse control, and irritability. We treat this with medications like SSRIs that inhibit the serotonin from being wasted and kind of recycle it. With an excess amount, and this could be caused due to a medication overdose or by medication interactions from other drugs, we can have serotonin syndrome. The symptoms of serotonin syndrome can be abdominal pain, diarrhea, sweating, fevers, tachycardia, elevated blood pressure, all the way to irritability, hostility, and even death. And the references that I used for this are listed here. So thank you for listening to my presentation. Thank you.